You know, there's a lot of controversy today about soy products. Are soy products good for me, or soy products, don't they increase my risk of cancer? Are they going to, stop my children from developing normally? There's all kinds of crazy things on the internet. It's so sad and ridiculous. The fear-mongering around soy is that some pseudo-experts, understand that soy contains some estrogen look-alike compounds. So they make the assumption that soy products with their estrogen look-alike compounds called isoflavones are going to stimulate reproductive cells and increase the rate at which they divide, that will lead to an increased risk of breast cancer or some other cancers, developing endometrial cancer, ovarian cancer possibly. But nothing could be further than the truth, in fact. These are people who are looking at it only on a very superficial level. If you drill down deeper and you follow the very, very detailed research that's been documented in the International Journal of Nutrition and Cancer and the Journal of the National Cancer Institute, the American Journal of Clinical Nutrition, what you see is that soy contains nutrients that do a lot of things. Help to block the ability of the more dangerous estrogens from even getting into the breast cells and into the prostate cells and into the endometrial cells. So it helps to decrease the likelihood there'll be overstimulation of those tissues. Not only that, but every day of your life, certain cancer cells start to emerge, and the cell has to be able to get those emerging cancer cells to commit suicide before they pose a threat to the rest of your body. And soy isoflavones and other nutrients in soy products have been shown to induce programmed cell death. It gets the cells that are becoming cancerous to commit suicide in a spectacularly magnificent way that's almost difficult to explain. Not only that, but once if a tumor starts to form, it can only become 1 millimeter in size, and then it can't get any larger unless it can secrete certain hormones to get more blood vessels to it, so it can get more blood, and then it can grow. And soy isoflavones have been shown to even block the ability of cancer cells to get access to new blood vessels. And so because there's all this controversy, a couple of years ago, in the International Journal of Nutrition and Cancer, this study appeared. They took women that already had breast cancer, and while they were waiting for surgery, they gave some of them 200 milligrams a day of soy isoflavones. That's a very high dose. And they gave the other group the placebo. Then they took healthy women who didn't have any breast cancer and gave them the 200 milligrams of isoflavones. And what they wanted to see every single week, as they were drawing out samples from the tumors and from the healthy breasts, they wanted to know what was the rate at which the cells were dividing compared to the rate at which the cells were committing suicide inside those tumors and healthy breast tissue. And here's what they showed. The women that were getting the 200 milligrams a day of soy isoflavones, it was causing the cells to die or commit suicide at a faster rate than the cells could actually divide and replicate. The tumor size was actually shrinking with the soy isoflavones. Then they did a study in men, and what they showed was that men that already had prostate cancer, who were just undergoing watchful waiting, the big indicator in prostate cancer is how fast is the PSA level rising. The prostate-specific antigen is a blood marker for prostate cancer. As it goes higher more quickly, you know it's a more aggressive cancer. Soy isoflavones at just 100 milligrams a day in men with known prostate cancer slowed down the rate at which the PSA was rising to such a significant degree that it made the cancer much less threatening to the rest of the body. And the women who were healthy, who were taking the soy isoflavones, in that study I told you about, it was not causing their breast tissue cells to divide at a faster rate than normal, not putting them at risk for increased chance of having breast cancer. Look, here's the reality. If you look around the world, individuals that are on a high soy-based diet, the incidence of breast cancer in those countries is 75% lower than it is in North America and much of the Western world. In men, 80% fewer clinically important prostate cancers in those parts of the world where men are eating soy. And it doesn't cause infertility because in certain parts of the world where they eat a lot of soy, the populations are huge, enormously big, much bigger than you have in much of the Western world. So forget about all this fear-mongering around soy. The reality is you need to get as many isoflavone milligrams as they get in the traditional Asian diet, which is about 35 to 50 milligrams a day. If you go to meschinohealth.com and you look at the literature there, you'll see an article that shows you exactly how to do that, and some supplementation might be useful as well. So the reality is, please include soy products in your diet. If you're not allergic to them or super sensitive to them, then they have a huge part to play in a health-promoting, optimal living program. You know, if you enjoyed this video and you felt that you got some meaning from it, then I would really strongly recommend that you go to meschinohealth.com and you can sign up for my newsletter so I can coach you on an ongoing basis as I review the scientific literature from around the world every month. I send out, you know, a little weekly message like this that brings people up to date on the latest things they should do so they know how to look after themselves properly. You'll also see how you can get a free download of my book called the Meschino Optimal Living Program, 7 Steps to a Healthy, Fit, Age-Resistant Body. It's a book I believe everyone should read. So you see how you can get a free copy of that when you go to meschinohealth.com. So hopefully we'll have a chance to meet again and I'll be able to provide you with ongoing lifestyle coaching that's going to be meaningful so you can have a highly functional body and mind for the longest period of time.